A new study conducted by Doctors Without Borders and the Guinean Ministry of Health shows that an oral cholera vaccine proved to be effective in controlling the disease during a recent outbreak. Public health authorities in Guinea administered the vaccine, called Essential, to children in 2 rounds over a 6-week period in 2012. The vaccine dramatically reduced disease transmission by 86%. The researchers say their findings support using the vaccine to contain future cholera outbreaks. The results of the study are published in the New England Journal of Medicine. And joining us is Lora Shimp, a senior immunization technical expert with John Snow, Inc., a public health management consulting and research organization dedicated to improving the health of individuals and communities throughout the world. Ms. Shimp, welcome to the show.
Thank you.
First of all, what do you make of this new finding, a possible new cholera vaccine? How is this an added value to what we already have?
It's very encouraging because, I don't know, your listeners are probably aware, the Global Alliance for Vaccines and Immunization has been internationally supporting development of new vaccines and to try and reach vaccination beyond just the normal child vaccination, but actually to be able to help adult populations with some of these neglected tropical diseases as well as, beyond just the normal child illnesses. So it's very encouraging that, particularly for outbreak control, because cholera, as we know, can be very infectious.
Absolutely. Now, you've been working on the ground in Africa and many other countries, many other continents, and some countries in Africa. Let me precise this. So with your experience on the ground, we still see that there are children who are dying from vaccine-preventable diseases. What do you think that is lacking? Where is the issue here?
A lot of it, there's commitment, I think, international commitment, Ministry of Health commitment in countries. In a lot of cases, it's the funding to ensure prevention and to get countries to help support preventive health. But then also, immunization is a routine service. So every year we have children born, every year new people and children need to be vaccinated. And a lot of the challenge is having the recurring operational costs to get those services to that, what we call the last mile, getting it out to those children in very rural communities or in dense urban areas who need the vaccines the most.
Remote areas where it's very difficult to access.
Exactly. Logistically, the end of the road or the end of the lake or the middle of the lake, the island.
Yes.
But then also in dense urban areas, the communities that may not want to be so visible. Immigrant communities or populations that have been marginalized.
So can you share an example of best practice in a country or a community that has succeeded in perhaps a program that was really making a difference?
Yeah, in several countries we've seen, particularly with the new vaccines coming in, we're seeing huge reductions. I mean, measles is one that everybody knows. You bring measles vaccine into a community and you see the measles incidence and cases go immediately down. But with some of the newer vaccines, for example, a few years ago when I was in Madagascar, I had talked to a doctor out in a rural community, and he had been seeing a lot of cases of Haemophilus influenza B, a type of respiratory disease. And he noted that in the 2 years since they had introduced the vaccine, that he no longer saw cases in his community. And he said, my treatment didn't change, it's the vaccine that helped. And that was really a positive result.
Thank you so much, Lora Shimp. We have to leave it there.
Thank you very much.
And that was Lora Shimp, senior immunization technical expert with John Snow, joining us here in the studio. And that's your Africa 54 Health Report for you today. Back to you, Vincent.
Wow, thank you very much, Linord Moudou, for joining us today. Be sure to watch for Linord Moudou's every Tuesday and Thursday for the latest health news in Africa right here on Africa 54.